The medical assistant assists as required during the physical examination. This includes helping the patient change positions for the examination of different parts of the body, handing instruments and supplies, and reassuring the patient to reduce apprehension. Prepare the examining room by making sure the room is clean, free of clutter, and well lit, and that the room temperature is comfortable for the patient. Sanitize your hands. Assemble the equipment according to the type of examination to be performed and the physician's preference. The instruments and supplies often required for a physical exam include a tape measure, an otoscope, tuning forks, a tongue depressor, a percussion hammer, lubricant, a Hemoccult slide. Other supplies usually required include a patient gown and drapes, disposable gloves, antiseptic wipes, a thermometer, stethoscope, and sphygmomanometer. Arrange the instruments and supplies in a neat and orderly manner on a table or tray so that one item does not lie on top of another. Obtain the patient's medical record. Go to the waiting room and ask the patient to come with you to the examining room. Greet your patient and introduce yourself.
Right on this way. My name's Diana.
Ask the patient to be seated.
What is your full name?
Christy Barton.
Okay. And what is your date of birth?
September 20th.
Identify the patient by her full name and date of birth to avoid mistaking one patient for another. Use a calm and friendly manner to put your patient at ease. Seat yourself so that you are facing your patient at a comfortable distance of about 3 to 4 feet. Obtain and record the patient's symptoms. Good rapport is essential for obtaining information that the physician will use to make an accurate diagnosis and prescribe a treatment plan. This is especially true when asking sensitive questions. Information relayed to you by the patient is strictly confidential. Revealing protected patient information to anyone but those who are authorized is unethical and illegal. Next, measure the patient's vital signs and chart the results. Determine if they fall within normal range. Normal body temperatures fall between 97 to 99 degrees Fahrenheit. The normal pulse rate of an adult is 60 to 100 beats per minute. The normal respiratory rate of an adult is 12 to 20 per minute. And normal blood pressure is a reading lower than 120/80. Measure the patient's weight and height. Make sure all values are accurately documented. An important role of the medical assistant is to instruct and prepare the patient for the examination. Ask her if she needs to empty the bladder before the examination. An empty bladder makes the examination easier and more comfortable for the patient. If a urine specimen is needed, tell the patient to void into a urine container. Provide her with a patient gown and tell her to remove all clothing and put it on with the opening in front. Offer assistance if you sense the patient may have any difficulty. Remember that disrobing is often embarrassing for the patient, so be sure to provide complete and clear instructions. Tell the patient that when she is done, she can have a seat on the examining table and that the doctor will be in shortly. Leave the room to provide the patient with privacy for disrobing. Make the medical record available to the physician. The record can be placed on a shelf near the outside of the examining room or in a holder mounted on the outside of the door. To protect the patient's privacy, it is very important to position the record so that the patient's identifiable information is hidden from view. Check to make sure the patient is ready to be seen by the physician. Knock lightly on the door before entering to let the patient know you are getting ready to enter the room. If the patient is ready to be seen, inform the physician. Many offices do this using a color-coded flagging system mounted on the wall next to the examining room. The flag to notify the physician that her patient is ready to be seen is blue. Assist the physician with the examination of the body systems. Begin by making sure the patient is correctly positioned in a sitting position on the examining table. Place a drape over the patient's thighs and knees to provide warmth and modesty. Prepare the ophthalmoscope by turning it on. Hand the physician the ophthalmoscope and dim the light when the physician is ready to examine the eye. The dim light helps to dilate the patient's pupils so the physician can better see the interior of the eye. Prepare the otoscope by attaching a disposable speculum to it and turning it on. Hand the physician the otoscope when it is requested to examine the patient's ears. Hand the physician the tongue depressor by holding it in the center to prevent touching the part that is placed in the patient's mouth. The physician hands you the tongue depressor after it is used. Transfer it by holding it at the center to prevent contact with the patient's secretions, which may contain pathogens. Dispose of the tongue depressor in a regular waste container. Hearing acuity is tested using a tuning fork. Hand the tuning fork to the physician when she is ready to test the patient's hearing acuity. Patient reflexes are tested using a percussion hammer. Hand the percussion hammer to the physician when she is ready to test the patient's reflexes. Position and drape the patient as required for examination of the remaining body systems. Incorrect positioning and draping can lead to patient discomfort and embarrassment. Be sure to allow only a minimal amount of exposure. While the physician concentrates on the examination, you should continually assess the patient and provide for any needs, including assistance, encouragement, and physical comfort. A knowledgeable, professional, caring, and helpful approach will ease the patient's concerns. At the end of the examination, let the patient rest in a sitting position on the examining table before she gets off of it. Some patients become dizzy after being positioned on the examining table. Never leave a patient who is young, very old, or weak alone on the examining table. Assist the patient off the examining table to prevent falls. Ask the patient to get dressed and provide assistance if needed. Leave the room to provide the patient with privacy for dressing. Provide the patient with any necessary instructions, such as patient education and scheduling a return visit. Give instructions involving medical care in terms the patient can understand. Avoid using medical terms. Sanitize the hands and chart any instructions given to the patient in her medical record. Escort the patient to the reception area. Clean the examining room in preparation for the next patient. Discard the paper on the examining table. Check for body secretions. If present, apply gloves and clean and disinfect the table. Unroll a fresh length of paper on the table. Discard all disposable supplies into an appropriate waste container. Make sure there is an ample supply of clean gowns, drapes, and other items for the next patient. Remove reusable equipment to a work area for sanitization, sterilization, or disinfection as required by the medical office policy.